Welcome. Today we're exploring AI in Mental Health, Promise, Peril, and Practice by Philip Alla, PhD, University of Detroit Mercy. AI tools are transforming how we approach care. They offer incredible opportunities for access, efficiency, and support, but they also come with significant risks, including reinforcement of false beliefs, privacy concerns, and ethical challenges. In this session, we'll cover what clinicians need to know, understanding AI-assisted delusions and risk factors, evidence-based tools and safe practices, privacy, ethics, and regulatory guidance, clinical strategies for integrating AI responsibly. By the end, you'll have practical knowledge to use AI safely, support your clients effectively, and stay prepared for the evolving landscape of digital mental health. AI mental health tools are exploding. Millions are using chatbots for support because they're cheap, anonymous, and available 24/7. But many patients use them without guidance. Long waits, high costs, and stigma push people to rely on bots alone. Now, lawsuits, attorney general investigations, and NHS warnings are raising red flags about safety and privacy. That's why therapists must understand both the risks and the evidence. Clients are already using these tools, and they need professional help to separate what's useful from what's risky. This is the moment. Rapid adoption, rising scrutiny, and the urgent need for informed guidance. In just the past 12 months, we've seen major shifts in how governments and health systems are responding to AI in mental health. First, Illinois passed a new law in 2025. It bans companies from claiming to provide therapy through AI alone, unless they are properly licensed. Second, a coalition of state attorneys general came together, demanding that AI firms do more to protect vulnerable users. Third, the NHS issued a strong warning. Chatbots should not be considered safe substitutes for therapy. And finally, litigation has begun after the tragic suicide of a teenager was linked to the use of ChatGPT. These developments make one thing clear: the legal, ethical, and clinical landscape is changing quickly. AI in mental health is not a distant debate. It is here, right now. Let's look at some of the major cases and incidents shaping the debate around AI in mental health. First, in Belgium, back in 2023, a man tragically died by suicide after extended conversations with a chatbot. Second, in the United States, BetterHelp faced an FTC case for misusing sensitive data. The settlement? $7.8 million. And most recently, in California, in 2025, a lawsuit was filed against ChatGPT after the suicide of Adam Rain, alleging the chatbot contributed to the tragedy. These incidents highlight the very real consequences when AI in mental health is deployed without clear safeguards, oversight, and accountability. We're exploring a concept called AI-assisted delusions. This isn't an official medical diagnosis, but it describes an emerging pattern in how humans interact with AI. First, AI can reinforce false beliefs. Because bots often provide information aligned with user input, they may unintentionally strengthen ideas that aren't accurate. Second, some people may experience over-identification with an AI relationship. This means the connection with the AI feels intensely personal, even replacing real-life social bonds. Finally, there can be a substitution of human support. When people rely on AI for emotional or social support, it may reduce engagement with friends, family, or professionals who provide essential human interaction. Understanding these patterns can help us use AI responsibly, keeping interactions healthy, informative, and supportive. Let's talk about some risk factors that can make AI-assisted delusions more likely. First, loneliness, isolation, and parasocial reliance. People who spend a lot of time alone or rely heavily on one-sided relationships with AI may be more vulnerable. Second, pre-existing psychosis vulnerability. Individuals with certain mental health conditions may be at higher risk of over-identifying with AI or accepting false information. Third, bots designed to be agreeable. Many AI systems are programmed to confirm or align with user input, which can unintentionally reinforce mistaken beliefs. Finally, secretive or compulsive use. When AI interactions replace social or professional support or are used in isolation, risks increase. Being aware of these factors helps us engage with AI safely and maintain healthy human connections. Now, let's look at some evidence-based tools that can support mental health safely. First, Rejoin, approved by the FDA, is an app designed as an adjunct for depression. It provides structured support under professional guidance. Next, Sleepio, recommended by NICE, delivers cognitive behavioral therapy for insomnia through a digital platform, helping improve sleep with proven techniques. Another tool, Limbic Access, used by the NHS, offers AI-assisted intake and triage, helping direct users to the right professional support efficiently. It's important to note that general chatbots are not safe substitutes for therapy. While they can provide information or conversation, they lack the clinical oversight and tailored guidance needed for mental health treatment. Using AI responsibly means combining technology with evidence-based care and human support. Finally, let's talk about privacy and ethics when using AI for mental health support. The FTC has taken action before. For example, BetterHelp was fined for data misuse, highlighting the risks when sensitive information isn't handled properly. Many consumer-facing AI chatbots do not protect personal health information, so conversations may not be confidential or secure. Because of this, clinicians must carefully vet vendors and digital tools before recommending them, ensuring privacy, security, and ethical standards are upheld. Awareness of these issues helps users engage with AI safely while protecting their personal information. Here's some clinical guidance for safely integrating AI into mental health care. First, ask about the frequency and nature of AI or chatbot use. Understanding how often someone interacts with these tools is key. Next, screen for concerning patterns. Look for secrecy, dependency, or signs that the AI is reinforcing delusions or false beliefs. Then, plan for safety. Make sure there are crisis strategies that do not rely on bots, ensuring immediate human support is accessible when needed. Finally, obtain consent by clearly disclosing the limits and risks of AI tools so users understand what these systems can and cannot do. Following these steps helps clinicians guide safe, informed, and ethical use of AI in mental health support. AI tools can feel supportive because they're always available and agreeable, but it's important to remember they don't monitor safety like a clinician. Let's work together to build a crisis plan that doesn't depend on a bot. This ensures you have real human support and reliable resources when you need them most. Some AI interactions can be high risk for mental health. First, AI can validate persecutory or grandiose content, unintentionally reinforcing harmful beliefs. Second, the bot may be treated as a confidant, even more than a therapist or family member, which can reduce essential human support. Third, some bots might suggest unsafe actions, putting the user at risk. When these patterns appear, it's critical to escalate, implement crisis planning, and document the concerns carefully, ensuring professional intervention and safety measures are in place. Looking ahead, there are several important trends in AI and mental health to keep an eye on. First, state laws are tightening around the use of AI in therapy, increasing legal oversight. Second, Attorney General enforcement is targeting youth-focused bots, aiming to protect minors from unsafe digital interactions. Third, research into AI-assisted delusions is expanding, helping us understand risks and guide safe usage. Finally, there's a shift toward regulated digital therapeutics, emphasizing evidence-based, clinically supervised AI tools over general-purpose chatbots. Staying informed about these developments helps both clinicians and users navigate AI safely and responsibly. Here's a quick clinical checklist for safely managing AI use in mental health care. Ask about AI use during intake to understand how often and in what ways clients interact with bots. Use only regulated tools like Rejoin, Sleepio, or Limbic, which are evidence-based and clinically supervised. Always develop a bot-free crisis plan, including resources like 988 or local support services. Educate clients that AI is not a therapist and cannot replace professional care. Protect personal health information by avoiding consumer chatbots that don't safeguard PHI. Following these steps helps clinicians guide safe, responsible, and ethical use of AI in mental health. Introducing AI microcourses, designed for busy professionals who want to learn quickly and effectively. Each course takes just 6 minutes and focuses on practical professional skills, administrative efficiency training and education tools, clinical workflow enhancements, ethics and privacy, psychoeducation resources, AI dashboard, customization, how it works. Complete each module in only 6 minutes. Receive an access code to unlock your AI dashboard. Explore secure training templates and workflows. Build continuous learning directly into your professional practice. These courses make it easy to stay up to date, enhance your workflow, and integrate AI safely and effectively. Coming soon on StudyAid. Institute. As we wrap up, it's clear that AI and mental health is inevitable. There are tremendous opportunities, including improved access, augmented care, and more efficient triage. At the same time, there are risks, such as reinforcement of delusions, privacy concerns, and potential liability issues. The therapist's role is to be prepared, stay informed, pursue appropriate training, and guide clients safely through AI-supported care. By understanding both the potential and the pitfalls, we can use AI responsibly to enhance mental health support while protecting our clients.